Welcome back. My next guest is Dr. Tharun Karthikeyan, who is an orthopedic surgeon with the Lexington Clinic. Got all that out because to your patients and to me, you're known as Dr. K.
Indeed.
Now, I say orthopedic surgeon. Tell me a little bit about yourself and some of the things that you do.
Sure. So I'm originally from West Virginia, and I did most of my training at the University of Pittsburgh. I did a fellowship in total joint replacement in Charlotte and have been in Lexington since 2012 and practiced with the Lexington Clinic.
Now, you mentioned total joint replacement. One of those that you're really good at is the knee. And robotics is a big thing. So you're doing that. Tell us about it.
Sure. So I think robotics is the next great frontier in terms of improving knee replacement. And so we're really excited to have that technology at Lexington Clinic, and we feel fairly confident that this is going to be the key to really improving outcomes for patients, relieving their pain and improving their function.
So you use the ROSA robotics system. So what are some of the benefits of doing it that way?
Sure. So the robot we really use primarily as a measurement and planning tool. And so the ROSA really allows us to be very precise in terms of the way that we balance the knee, in terms of the way that we position our components. And it allows me to make a very personalized plan for each patient to give them the best possible knee, because one of the things we're learning is one size does not fit all when it comes to knee replacement. And
you're able to adjust to that patient specifically versus just taking a knee off the shelf, so to speak.
Yeah, exactly. And what we're able to do is sort of virtually make tiny adjustments and see how those adjustments will affect the overall function and balance of the knee. And if we decide that ahead of time, then we only have to make cuts one time.
But the robot doesn't actually do the surgery.
No, I wish it did, but the robot really helps us to measure and execute the plan that I devise.
Okay. So how do you compare a robotic surgery to just a conventional knee replacement?
Sure. I think there are some very minor differences. From a patient standpoint, you shouldn't notice all that much. The size of the incision is basically the same. The operation takes about the same amount of time. There are a couple of extra incisions further down on the leg that we don't use with conventional instrumentation, but they're fairly small. I think the main benefits for the patient are because we have to dissect a little bit less around the knee, because we can make some of the plans virtually, that they should notice a little bit less swelling, a little bit less inflammation, and we're hopeful that over time that translates into earlier recovery, early restoration of motion, and faster return to function and normal life.
Well, who's a candidate for knee surgery, and how do you know when that time has come?
Sure. I think that the most common reason that we see patients in the office is because their knee hurts, frankly. And so what we would recommend is, if your knee does hurt, then make an appointment with us or another qualified orthopedic surgeon. We would typically start with a physical exam and x-rays, and that'll give us some idea about how much arthritis you have. Once we determine that arthritis is your diagnosis, then we'll typically talk about various non-surgical treatment options, which is always our first choice.
Well, now you mentioned something. What would be a non-surgical?
Sure. The most common non-surgical treatments are non-steroidal anti-inflammatory drugs, things like ibuprofen or naproxen. There's a variety of prescription medications. Other non-operative modalities include steroid injections. There are a variety of other types of injections that we can sometimes use in certain patients as well. Usually as arthritis progresses, many of those non-surgical treatments start to lose some of their efficacy or power. And when that happens, then that's the time that we discuss surgery as an option.
And that surgery can now well be a little easier with robotics.
That's our hope. That's
all right. Well, thanks for coming in. Thanks for the care that you give to the patients.
Absolutely. Thank you for having us.
All right. And if you're having knee pain, Dr. K with the Lexington Clinic can help. We'll be right back.